you go.
Okay. I just want to demonstrate a laser technique. Let's have Matt come a little bit closer over here. We both have our glasses on. There's actually a reflective thing that can occur with the laser, so you're going to protect your eyes, with the, from any sort of reflection. But you can see as I do the laser, it's actually not doing a treatment right now, so I can actually hold it in one place without any sort of buildup of heat. But you can see there's actually a laser beam that occurs with the laser. So as we're doing it, we're moving it through the tissue. This applicator is actually a glass ball. Okay, so actually can perform, like we talked about in the blog post, a deep tissue laser technique doing this. So it can be used in many parts of the body. I'm going to show you here in a second how we use it for plantar fasciitis. But I just wanted you to see that this is actually a laser beam. So when you come in, you're going to feel a gentle warming as we move the laser across the skin. The heat is not our intention with the laser. It's a side effect of the laser. It's the photon energy that creates the effect in the cells, like I mentioned in the blog post. So the effects, of course, of the laser, as I mentioned, are to decrease circulation, to increase metabolism, to accelerate the healing, to decrease inflammation. Okay, so let's have you show the foot over here. So I'm going to turn this on. So it's going to be like a truck backing up sound, a little beeping sound here. So that means that the laser is on. So as we perform our technique, pretty much our plantar fascia protocol, I can get in and I can actually push and mobilize the tissue as I use the laser. Okay, so I'm applying a massaging effect. I can do a friction massage through here as well. Okay, I can actually stretch the fascia and perform pretty much a stretch at the origin of the fascia through here. I'll come up and I'll kind of work the whole, we call it the tarsal tunnel through here. Your tibial nerve courses, deep in the calf, comes around the inside of your ankle, courses down here, and then it splits. So I can actually follow the course of that nerve as it goes through the tarsal tunnel. And there's a lot of great research on the effect of laser on nerve healing. So in some cases, plantar fasciitis is a result of a nerve that gets entrapped in the inside part of your heel through here. So we'll work the laser all the way through. I'll mobilize it. As I work it, we kind of move in a back and forth direction this way. Then we'll cross, do like a perpendicular pattern right after that, all the way through. Okay, work the outside of the heel, get all the way through here. Same thing, I'll stretch it and mobilize it, work that tarsal tunnel again. Okay, so go ahead and turn this off. Okay, and we'll put her down here. There's many different heads that we have for the laser as well. Put this on standby here. Okay, so we take this off. We can actually do more of a dispersive head on here, so you twist that on there. It's as simple as that. Okay, so same idea applies. Okay, so instead of there being a deep tissue effect, we can actually, if the tissue is too sensitive, or if we're trying to broadcast the laser, instead of being very specific with the laser beam, we can actually get in and do this sort of treatment. So I'm treating the Achilles tendon and get in and work this whole area through here, kind of down that way. You can see same idea, of the laser beam, but it's more spread out. It's not as small or as focused as the smaller heads. And we do have larger or actually smaller dispersive heads as well. It just depends on what we're treating in the system. Okay, so and of course, go back on me again. We can actually do the laser treatment for the neck, for the low back, for the shoulder. You can kind of treat the entire shoulder region through here. We can actually make people mobilize their shoulder as we're working it here. It's great through the neck through here with the nerves that come out of we call them the neural gutters of your cervical spine. And get in and treat this whole region through here into your trapezius, kind of following the brachial plexus. We can actually use these larger glass ball applicator as well. It's a little bit bigger obviously than the smaller one. You can attach these, and then I'll just show you real quick on my very cooperative patient Diane here. And so it isn't here for her back or her neck. It's here for her foot. I'll put that on there. So there's the applicator right there, and then get in and kind of work the whole low back this way, up and down this way, perpendicular to it, and get like right over a disc, for example. Because the laser can penetrate 8 to 9 centimeters into your tissues, back through here, work the whole system, all the way back and forth. And we'll go a little slower just so that laser can penetrate a little bit deeper as it goes through, get into the glutes as well. Okay, so that's a little introduction to the laser, and any questions, give us a call. Thanks.